But what I would love to see, of course, is HR genuinely taking its seat at the top table in terms of all the strategic debate about the future of health and social care, the future of the NHS, how we build the capabilities we need to sustain what we have to do in health and social care for all of our people everywhere.
Hello and welcome to the fourth episode of our In Conversation With series, a new programme of monthly videos, podcasts and transcripts designed to give you the opportunity to hear directly from those influencing our NHS whilst you enjoy a coffee, a walk or maybe just some time away from your emails. My name is Julia Tybura and I'm a Non-Executive Director with the Liaison Group, as well as Managing Director of Xenon Consulting. Today, I'll be talking with Peter Cheese, Chief Executive of the CIPD. The focus of our conversation today is about the challenges, changes and thinking differently. What could our NHS workforce look like in 10 years' time? Peter, thank you so much for joining us today.
It's my pleasure, Julia.
We're going to be talking about the challenges, changes and thinking differently about the NHS workforce. And in the recent HR and OD review led by Prerna Issar and Tom Simons, which I know the CIPD have been actively working with them on, two sort of major issues emerged from that. One was the world of work and healthcare will never be the same, given what's happened in the last 18 months or so. But also that we have a really unique moment to co-create a new future of our NHS, HR and OD functions. Now, my understanding is that through having a conversation on these issues, it is hoped that it creates some real inspiration in otherwise truly unprecedented times. But before we look into our crystal ball into the future, what do you think are the current people-focused strategic challenges in health and social care?
I think they're very broad, Julia. I mean, we know in workforces everywhere, there's a lot of change going on. The world of work, as you touched on, is changing significantly, driven by many things. It's not just about technology, it's about social change, demographic change, even geopolitical change, and economic uncertainty and other things as well, which affects the public sector as much as it affects the private sector. But I think, that certainly from the public domain standpoint, if you will, the biggest challenges still seem to be those of staffing and the many open positions across the NHS, and of course the pressure which the NHS has been much more broadly under. And then we've got this wider debate about more integration between social care and healthcare and a much more inclusive system in that regard. And these are very big, long-standing questions about our health and social care system. So without getting into all of those sort of wider questions, I think that the real challenges, and certainly the challenges front and center for the HR community, are of course about how we attract and retain the staff that we need, how we make sure that the cultures across the NHS and all the different trusts and all the different facets of the organization are supportive to people, and that we really are putting people front and center, because there's been huge pressure. And we don't have to spell that out. There's been enormous pressure on our health and social care systems, just over the last 18 months, which has, of course, been accelerated by the pandemic, but for many years. And I think, therefore, this idea of a much more people-centric thinking, which I know that Prerna and Tom are trying to drive through their work, supporting our communities of people in all aspects of the work across the NHS is absolutely vital. And opening up, hopefully, and we'll get onto this, I'm sure, in terms of longer-term planning, the pipelines, if you will, of future talent that we need to sustain what, of course, will continue to be pressures on health and social care as the demography of our country changes, and as healthcare systems and procedures all change. All of those things are going to continue to drive, as I said, a lot of pressure on staffing and resourcing across the NHS.
Mm. No, I mean, I think, some key words there, obviously integration, inclusion and people-centric, but that pressure It has felt, I think, for a lot of my colleagues and my clients in health and social care in the last 18 months, a huge amount of pressure. And I think that continues now. So even if before, again, we look into the crystal ball, we still have that ever increasing pressure. Do you have any thoughts about that in terms of sort of well-being and resilience as we stand at the moment?
Yeah, I think one of the most important things, and we're seeing well-being and resilience, of course, is a very resonant theme everywhere, but is to truly find ways to engage with all of the staff, to understand how they're feeling. Because at the end of the day, whether it's well-being, whether it's inclusion, all these sorts of questions are very much about engaging with and listening to the lived experience of people in all aspects of the work that they do. And what is a good thing that I think has emerged through the pandemic is it has unquestionably, in organizations I talk to everywhere, in every sector, put the idea of people much more front and center of our thinking. Because at the end of the day, the pandemic was a human crisis, so it's focused a lot more on people. And of course, the health and social care systems have borne the brunt of an awful lot of that support for all of us. So we have to make sure we really are engaging with all of our people. We're listening to them. We're understanding what's impacting them. We're engaging with them in terms of their physical as well as their emotional and mental well-being, which is a very, very important part of the idea of resilience. And then we are working up through the strategies that support people in those regards, which are everything from culture, tone from the top, employee assistance programs, training, skills development, many, many parts of what, of course, are central agendas for the HR profession in supporting of the workforce or workforces everywhere.
Absolutely. Thank you for that, Peter. So now let's look through the crystal ball then. If we look forward 10 years to 2031, what do you think the people-focused strategic challenges will be for health and social care in 2031?
Yes, I mean, it's really important, this sort of crystal ball thinking, because at the end of the day, what I've recognized in having worked in many different parts of the health and social care sector is its incredible scale and complexity. And of course, it's very easy in that context to get rather overwhelmed with the sort of day-to-day, year-to-year issues and not have that ability or that space to really think ahead and say, okay, if we're going to solve the problems today and then put them in a context of the future, then let's work more from a sort of 10-year scenario and work backwards into today's challenges and issues. And certainly looking ahead, there are many trends, as I've already briefly touched on, shaping the future of work, the jobs that we do, the skills that we need, so the nature of the workforce itself, and of course our workplaces, which are being debated a lot more in terms of more flexible ways of working and so on. So that all of those are the things that are shaping a future context. Now, none of us can predict exactly what the jobs will look like. So I tend to talk about this much more from a set of principles for the future. So the first thing is to say, okay, so if we're looking 10 years out, let's look at how technology can and could impact the nature of jobs and skills that we need. And I think there's little doubt that when you look at our health and social care systems and looking at it from the point of view of future demand as well, where aging demographics, as I said, things like changing medical procedures and so forth, and technology and medicine itself will all be part of what shifts and changes the needs of the workforce to support that. Now, you can look at interesting examples. I've just finished and published a book called The New World of Work and looked at some of the interesting examples in other countries around support to our older parts of our populations, in particular things like social care. And if you look at countries like Japan, which has the oldest demographic in the world, that they've had to use technology to support that older demographic. And they've really been forced into it in lots of different ways. So there are interesting examples. So, for example, the use of robotics and robots in social care of the elderly. Now, as we sit here today, that might seem a little far-fetched, but there's a great quote which I often use, which is Bill Gates, who said that we tend to overestimate what will happen in 2 years, but underestimate what will happen in 10. And I think it's definitely not too far-fetched to suggest that in 10 years, we will see the use of things like robot support to people in social care and indeed in hospital care as part of that wider health and social care provision. Exactly how that will play out, I don't know, but it has to be part of the solution. And that means, therefore, also how we think about the jobs of the future, and reskilling and upskilling becomes an absolutely central principle, going back to that point I made about principles. So if we can't predict all of the jobs, what we do know is they're going to change. And that means that they are going to change in terms of the skills needs that we have. And that means that our ability to upskill and reskill our people in all facets of the work they do becomes ever more important. I think we've also got to look at different solutions in terms of the diversity of our workforce, the very diverse skills that we're going to need. If we're saying technology is playing a bigger part, we've got to understand that from the HR profession as well. And we've got to bring more of that insight into our profession about things like job design and understanding how technology truly can change jobs, but that we are creating jobs that are good for people. Because an oft-quoted point is that the future of work is human. So these become really, really important questions for our profession, being able to look ahead, think about questions like how technology can affect jobs and things like that. But how do we then make sure that we are designing jobs that are good for people, built on job quality principles and good work principles? And how do we make sure that we've got the capabilities in place to upskill and reskill staff in all kinds of jobs right across the workforces that we have from today and over the next 10 years?
I mean, you've raised a lot of very interesting issues there, Peter, and I look forward to reading your book on New World of Work. Thank you for sharing that with us. I didn't write a book, but I wrote a chapter and contributed to a book for the European HRD Circle a couple of years ago. And what you said there really resonated with me, because I looked at data ownership in people management and development in 2039. So we were looking forward 20 years.
20 years, yeah.
But this was very, very interesting. So looking at who owns the data.
Yeah.
So if you're looking at the tech and the AI that you're talking about, I absolutely agree with you. The overestimate 2 years, underestimate 10 years, totally can see that. And I have seen that in the work that I've done on futurology of work. But who owns the data, Peter? Do you have any thoughts on that?
It's a really interesting, of course, a very current question, isn't it? There's a lot of debate now going on because of the pandemic and tracking more data about us. I've signed on to the new NHS app, which I think is wonderful, but I acknowledge in doing that a lot of my data will be shared. So these are very, very important debates even today, and as you point out, Julia, will become more and more important for the future. There is no doubt that as we work forwards with technology and digital capabilities, the data about each of us is going to become more important in order to be able to provide the services that we all need. And certainly in terms of health and social care, probably nothing's going to be more important than that, isn't it? It's our ability to have more information about people's care needs, their health needs, some of the trends that are emerging, being able to preempt things, more preventative care, all those sorts of things are going to be very dependent on more data. But that does, as you say, bring out these very, very important questions about who owns it, who has access to it, and can I be assured as a private citizen that my health data is not going to be shared with people that I don't want it to be shared with. So these are real debates now, and I think part of it is also the ethics of all of this, which is a massive set of questions about the ethical use of data. So we can talk about things like health and social care data and say, well, I could probably get my head around why that would be important as a private citizen to share, because that's in my interest and a wider collective interest. But other things that are being talked about a lot, such as being able to collect data on how people are working. So I could take an example, which is in many workplaces, including in our health and social care workplaces, which is I want to optimize the use of my resources, my people, in terms of work scheduling. So the more that I can track about what they're doing, where they are, how productive they are, all these things that we actually have a lot of the ability to collect today, those begin to stray into some very challenging questions about ethics as well. And what is appropriate? And am I going to use that data for or against that individual? Or is it more about a collective understanding of how I'm using resources? So these are immense questions of trust as well. And I think any healthy organization has got to address these questions head on with their people and with their consumers and customers in order to retain the trust that they must have in order to further develop these ideas of use, the positive use of data for all of us.
Absolutely. And I'd be really interested to hear what you think about the role of the HR profession in the NHS, the role they're playing in the strategic narrative now. So now, what's their role in that strategic?
Yeah, very important, Julia. I've spoken to many groups of HR professionals across the health and social care sector over the last years, and I've always said, that there's never been a more important time for what we do in our profession, and it is really, really true. And of course, the pandemic, again, as we touched on, has accelerated many of the things that we need to be thinking about as a professional community. But what I also recognize in the health and social care systems is its sheer complexity. and in many organizations, even very, very large organizations that I've worked with before, of equivalent size and scale, when you look at HR, it generally has its hands on all the levers that are needed. Everything from what people get paid, or how we are driving our supply chains and talent and skills development and so forth. And yet we know in the NHS and across our health and social care systems, there are many different actors that we have to work with and seek to influence to drive what in the end needs to be a coherent and integrated people strategy for the whole of the NHS and the whole of our health and social care systems. So you've got those complexities and challenges. And of course, that means that in our profession, in this context, as much as any, our ability to work with and influence others that are all part of that integrated understanding of our workforce is a really, really essential skill set. And I absolutely believe that the role of HR, and I think it's a lot of what Prenner and others are trying to define, is to work with that idea of, here's our long-term people strategy, here's the kind of capabilities we're going to need to develop, here's what our workforce might look like in the future. And as we discussed, work back from that and then say, so what does that mean to us today? And then, of course, working, as I said, with all the different stakeholders that are involved in those discussions and debates, right across the domain of our health and social care systems. But, this really is a time for our profession to step up, to engage, to have the confidence to engage. So the other element, which I think is really important, and which is part of the plan, is to help to build the confidence and capabilities of HR professionals right across the health and social care systems. And if we're honest, and I've said this to HR professionals over the years, that we've often been the cobbler's children. We've often spent a lot of time worrying about everybody else's skills and capabilities, but not, frankly, done enough for ourselves. And now is the time we really need to do that. We need to see how we build some of these sorts of skills we've touched on. So more analytical skills, understanding how we can use data effectively, but doing it in the right context. Things like job design and organizational design, so that as we see technology begin to influence jobs and things of that nature, how do we shape those jobs in the right ways for the future? How do we really focus on the big outcomes that need to be driving what we are doing in terms of our interventions and the evidence that underpins those interventions? So, for example, on the well-being and care of all of our staff across our health and social care systems. These are really, really important and very strategic questions. And we need to make sure, as a profession, that we got the right skills and the confidence and the capabilities to address these sorts of questions, both now and in the future. Therefore, as I said, I think this is the other aspect of what's been worked on, is what have we got to do to invest in and benchmark and understand the capabilities we have across the HR profession everywhere. And that, as I say, is not just true of the healthcare systems, it's true of organizations, in my view, yes, everywhere in the world that we're now moving into.
Yes, I mean, you've brought to mind Dave Ulrich's competency framework. The centre of that competence framework, which you may recall, I'm sure you know it off by heart, is Paradox Navigator.
Yeah.
And I think that sort of competence and that role is so crucial for HR professionals to play. And I just wondered if you had any thoughts about that specific.
Yes, it's really important. And we built very similar constructs into the CIPD profession map. And yes, this idea, as you said, Julia, being able to understand paradox. Now, what is interesting to me in that, and I write a lot about it in the book, is that actually that's not just an HR skill, that's a leadership skill. Yeah. Because the reality is the world that we live in now is more uncertain and more complex. There's this famous expression, we live in a volatile, uncertain, complex and ambiguous world. Yeah. The VUCA world. That's true for all of us. So this actually is a really critical management capability, which again, I would say HR has a fundamental role in understanding how to develop good management capabilities, particularly people management capabilities, right across our health and social care systems. Because at the end of the day, it's not HR people who are managing the people, and particularly managing the frontline people. It's the consultants and the physicians and the nursing staff and all these others. It's all these people that need to have their skills and capabilities developed as well in terms of how they understand uncertainty and paradox and lead to support people effectively and understand their well-being, all those sorts of questions. But certainly, as you call out, I think for our profession, in looking to the future, as we've been exploring already, with these uncertainties and these paradoxes, how do we understand those things? And how do we, most importantly, understand the context in which we are operating? So another thing that I've certainly been saying for a while is we have to move beyond the idea there is some best practice manual that's going to tell us how to do everything. It's more about best fit, and it's understanding, as we describe it, being much more led by principles. So what are we trying to accomplish? And let's start with ideas like well-being and inclusion. And so that is a principle that we really want to make sure works across all of our workforces. So being principles-led, evidence-based, so that says, okay, not just what's the evidence in terms of the interventions that are going to improve these things, but of course, beginning with what evidence do we have of the nature of our organizations and our cultures and our workforces and demographics today? And those are really, really core analytical skills that we need. And then finally, that we are outcomes driven. So whatever we're doing, that the interventions, the evidence we're using, we're really clear on the outcomes we're trying to achieve, and that we can evidence how we have achieved those outcomes so that we can continue to promote these ideas going forward. And those are all ways, I think, of how we think about paradox, because in the old world, if we said, okay, well, things are more certain, and we rather relied on this idea of it was best practice, or we've done this before, I've seen this before, this is how this all works. And that is not just a mantra, as I said, from HR people I've heard. It's a mantra I've heard thousands of times from business leaders in every context. And now we all have to accept that the world is not so certain, and therefore we've got to deal with more of this paradox. We've got to train our managers and train ourselves as HR professionals to deal with that and lead, therefore, more from principles and evidence and clarity of outcome than just saying, well, here's what I've always done before, so that's what I'm going to implement. And that is a mindset shift as well as a capability shift.
So, Peter, what do you see as the biggest strategic workforce planning issues and challenges that we have today, and also looking into our crystal ball again in 10 years' time?
Yeah, I think when we think about strategic workforce planning, it's one of the biggest questions that many organizations are asking today. And if I'm honest, in my experience across many, many organizations over the years, we haven't always done a very good job of that. And it comes back to the points we were making about really look further ahead and then work back from that. And of course, if we look across the NHS and the health and social care systems, we know that there are huge challenges in attracting and retaining all the staff that we need. There are publicized, job vacancies which are in the hundreds of thousands or 100,000 plus. Now, how real those are, I don't know, but that's what's generally regarded as the numbers. And those numbers have been at that sort of level for a long time. And of course, we've become very dependent on being able to fill many positions across the NHS from outside of the UK. So by recruiting in people from the EU and further afield into many different jobs. And the challenge that creates is whether that's long-term sustainable. So when we think long-term, we've really got to find ways, I believe, in addressing some of those challenges. We can see today already a course of pressure on those recruitment supply lines. Brexit's been part of that, but also the concern, which we're hearing about more and more, of staff having gone through such a difficult time over the last 18 months. Will they stay within the profession? And so those are really real challenges around workforce planning today. So the point being that if we look 10 years out, then what are the ways that we can solve these questions, which without always having to be in what has felt like for a very long time, caught in this sort of shorter term trap of endlessly trying to fill positions, agency staff, and bringing people from outside of the UK in to fill these positions, and think more strategically about how can we build the supply side, the supply lines of nursing and clinical staff in better ways. Because I believe in any modern economy, by and large, countries should be able to sustain their health and social care systems through their own resources as far as possible. Because after all, I mean, every country is in the same position. Every country is looking at its forward demand on its health and social care systems, and there is not an unexhaustive supply of people from all around the world. So those become very, very important strategic questions, which really genuinely take, I think, that 10-year out view of the world and looking back and saying, all right, if we are to get to a sustainable position in terms of staffing across the NHS and the health and social care systems, then what have we got to do to change the paradigm, which has driven us for so long, where we've been endlessly challenged, it seems, on filling short-term positions. And that, of course, finally has put immense pressure on our profession, on the HR profession right across the NHS. So these are things, again, that help to shift this from operational and tactical responses into strategic responses in order to make sure over the longer term that we're able to really focus on the value-adding parts of what we do as a profession, not always having necessarily to chase our tails in some of the circumstances which I just described.
What role do you think the HR profession, the NHS, should be playing in 10 years' time, in your crystal ball?
Yeah, I think obviously there are some many good things. I mean, one of the great pleasures of my job is I do get to see many different things and many different organizations, and I can give you some great examples across the NHS. There's some real points of light, and I've always been absolutely thrilled when we run our big People Management Awards event every year, as we do, to seeing trusts come forward and parts of the NHS system coming forward with what they have done and the great things that they've accomplished. So the first thing I would say is let's build on what we've done, and what we can see is there's great points of light across the NHS. And as has been happening, I think, more and more through some of the big conversations, sharing those points of light across the profession and connecting the profession more than perhaps it's been in the past. And I know that's very much on Prennah's agenda, to try to bring the profession together more across the NHS and indeed into social care as well, and sharing those good practices, sharing the points of light. I think as we then look forwards, as we touched on, building our competencies and confidence and capabilities, very, very important. But what I would love to see, of course, is HR genuinely taking its seat at the top table in terms of all the strategic debate about the future of health and social care, the future of the NHS, how we build the capabilities we need to sustain what we have to do in health and social care for all of our people everywhere. And I've often described that when we think about strategy in the past, it seems to be missing a leg of the stool. So we would talk a lot about products and services and capabilities and financing and everything else, but we weren't talking enough about people, and not just people in terms of skills and capabilities, but also people in terms of culture and support, and how we're really going to make sure, particularly in the context we're talking, that we are caring for the carers and that we are building their sense of support and morale and engagement, which we know can be fragile at times because of the pressure that they're under. And that we really are helping to drive those ideas as strategic components of the strategy for the whole of our health and social care system, as much as anything else. And that is our agenda. That's the agenda for our profession, to truly be part of the strategic debates at the highest level of the health and social care systems, just as I would say it's true in any organization. And that is a leg of the stool or the chair or whatever analogy you want to use that we must build. And we have that, I think, within our gift as a profession. We need to have the confidence to push those ideas. And as I touched on before, make sure we are bringing together all the different elements that we have to influence in order to do that in a very integrated way.
Peter, that was a really interesting conversation. Thank you so much for joining us today.
No, it's my pleasure, Julia. I mean, we covered a broad range of, I think, really important themes, and it's great to have the opportunity just to discuss some of these things with you, and I hope it's of interest to the wider audience that I know you're sharing this with. So thank you very much.
Thank you. On behalf of everyone at Liaison Workforce, I would like to thank Peter for giving his time to our In Conversation With series. If you'd like to continue the conversation, please do get in touch with us using the website and email address currently on screen. We'd love to hear if you think anything was missed, or what questions you'd like to put to NHS thought leaders in relation to the future of the health and social care workforce. If you would like to take part in a future edition of this series, please do get in touch. Thank you so much for joining us.